Hello and welcome to this week's Health Tech Hour with me, Steve Roest. Each week we bring you the best news, views, and interviews with the clinicians, CEOs, leaders, investors, politicians that are guiding and changing the face of healthcare in the UK and beyond. As regular listeners know, I am a CEO and founder myself of a business called PocDoc. PocDoc is a very exciting business that is changing the way that diagnostics are conducted outside and sometimes inside of a GP surgery, focused on the prevention of cardiometabolic and renal diseases, starting with our healthy heart check. So, in 10 minutes, you, at the comfort of your own home, can give yourself a healthy heart check and find out your heart age and your risk of having a heart attack or stroke in the next 10 years. If you'd like to find out more information, if you'd like to hear more about what PocDoc's doing across the NHS and pharmacy, please head to pocdoc.co. That's POCDOC.co. Thank you, as ever, to everyone who's listening live on the amazing UK Health Radio. It's wonderful that we're on this show. We really appreciate the airtime and the slot that Johan and his amazing team have given us. Please also remember to listen into all the other UK Health Radio shows. There are many, many, many of them, and all with really fantastic, exciting presenters and guests. And also, thank you if you're listening on any of our podcast channels or YouTube channels. So, Health Tech Hour on any of the main podcast channels, or our YouTube channel, or watching this through a series of shorts on Instagram, on my Instagram channel, which is at Steve Roest, SteveRoest. So thank you very much for everyone for checking in. Much appreciated. On last week's show, my mind was blown, quite frankly, about the technology that we discussed with Tony Nicolaidis from Origin AI. His company has developed an ability for Wi-Fi signals to be used to detect heart rate, breathing, whether someone's fallen over, burglaries, just by using your existing router. It's an amazing show. Please check it out if that's your bag. On today's show, if anyone's been following the news over the last couple of weeks, the NHS has had quite the couple of weeks with the Darzi report in the state of the NHS. Some really bleak statements in there, also some statements of hope, but also quite a bit in there that, that sort of laid bare the challenges, shall we say, for the system and people working in the system. And then today, the announcement of the resolution for now of the junior doctor strike. I think the emphasis on the for now piece of that. We shall see what happens. But yeah, quite a lot going on. And so it's great to be returning to the front line of NHS care with my guest this week, who is Richie Mcgregor, Head of Digital and Performance at Cumbria Health On Call. And Cumbria Health On Call is a CQC outstanding rated social enterprise located obviously in Cumbria. And they're one of the largest care delivery services in the north of England. Richie, how are you? Welcome to the show.
I'm all good, Steve. Yeah, thank you. Thanks for inviting me on.
I can't hear you, Richie. Are you okay? Can you hear me? Are you there?
Yeah, I can hear you. I can hear you absolutely fine. Yeah.
He's just waving frantically at the camera. I can hear. This is a problem on my end. Just give me 1 second. Let me see what's going on.
Yeah. No props.
Hello?
Yeah. Can you hear me?
Yeah, you can hear me, but I can't hear you. So why don't we do this? While I figure this out, Richie, why don't you tell everybody a little couple of minutes on what Cumbria Health On Call is all about, while I try and figure out my sound problems.
No problem, Steve. No problem. We've recently rebranded to Cumbria Health. We felt as an organisation that the on-call part didn't really describe us as an organisation. We started off back in 1996 as generally primarily an out-of-hours provider of primary and urgent care. Since then, of course, we went on. We run free general practices, arrange daytime services that coincide with that, all of which are there to try and alleviate some of the pressure from from our hospitals in the region. But also in amongst that, we run a number of technology-enabled care services, which is something that, in particular, has been a passion of mine over the last 9 years.
I think we've sorted out the sound problems. So in effect, I can hear you. So apologies for that.
No
One of the
worries.
things I'd like to quickly touch on is like you guys have set the business up, or rather the enterprise up as a social enterprise,
Mhm.
right? So it's a what and why was that decision taken, and why do you feel that's a really important part of who you guys are?
Yeah, I mean, I think social values just really important, in all walks of life. So the organisation isn't a statutory NHS organisation. So although we do only deliver on NHS and other public funded organisations, there's one or two exceptions to that, but all of which is aimed at delivering care to the communities, but also by reinvesting any surplus back into our organisation, which is then again to the benefit of other partners. It's certainly something that the management and the executive team at Cumbria Health have always been particularly. It's always been quite close to their heart that be the case. And at least then, as well, when you deal with us, whether that's as a commissioner, whether that's as another provider trust, you can do so in the knowledge, of course, that any surplus that we then generate comes back into the organisation
Yeah, I think
to then develop further.
I think it's a really nice model. And touching on your point there, social values. So we're a pretty broad church. So I guess there's quite a few people probably listening that don't realize that social value is now a key part of, I think, a large number of NHS tenders, if
Mhm.
not all NHS tenders.
Yeah,
Could
very
you
true.
maybe just,
Corporate,
sorry, go on. What was that?
corporate social responsibility. Of course, that's something that's growing ever more in importance. And of course, in terms of that social value, particularly if you take our region for example, and there'll be lots of other regions across the UK. There'll also be a lot of regions across well globally. Um, Now, in terms of ensuring that we're having social value, I mean, a lot of what we've talked about, things like net zeros, obviously, always been spoken about. If I take our region as particular, so we're like the second largest region by land size in the UK, but we're also one of the most sparsely populated. So when we talk about bringing care closer to home, that resonates even more with the Cumbrian population than it will anywhere else. We have some examples of communities where if you were driving, it would take you an hour to get to your local hospital.
Wow.
If you were yeah, I mean, yeah, there's several examples of that in Cumbria, and of course, you're always at the mercy of weather.
Right.
One of the practices we have, Alston, so that's like the second highest market town. Sorry, that's the highest market town in the whole of England. Um, and of course, when the weather, I always
Yeah.
joke that sometimes it can be sunny on ground zero, and you can go up there and experience snow. And I've experienced that myself. Not very hot sunny weather at the bottom, but the sun's shining all the same. And that's one of the areas, of course, where we've really excelled in by able to provide social hubs within that area for that population.
Mm.
And if you were to drive from there to the local hospital on a good day, you may be getting there in 45 minutes. Um,
Wow.
so obviously
Yeah,
weather dependent is
that's a long distance. So, like, how did but what was the kind of evolution of care provision in these rural, more remote areas that sort of culminated in an organization like you, sort of not filling the gap necessarily, but assuming this kind of leadership role? Like 10 years ago, 20 years ago, 30 years ago, was it different, or was it sort of the same, but there just wasn't someone filling that gap and the locals just sort of had to suffer? Or what was the kind of evolution?
Yeah, so I mean, a lot of the general practices that we've so there's two answers to that question really. So in terms of the out of hours provision, so Cumbria Health have always been the out of hours provider for primary and urgent care since its inception back in the days of GP cooperatives. So that's when the practices, obviously, manned the rota, if you like, prior
Mm.
to that. And if you needed your GP during the night, then obviously it would be your own GP that would come. That wasn't sustainable for lots of different
No.
reasons, and it definitely wouldn't be sustainable today. It's well documented. The Darzi report talked about the fewer heads per population of GPs, for example. So that's where organisations like ourselves, and there's several of us right across the country, a lot of social enterprise. A lot of GP federations. There will be some like private entities that are delivering in that space. The example I gave you with Alston, so that one in particular was a single-handed, it was a single GP that was managing that practice, which it can be quite difficult to sustain over a long period of time. There was actually a national news campaign to look to see if they would be able to attract people into that area, and that's when
Mm.
Cumbria Health were involved, or Cumbria Health on Call as it was called then, just prior to the rebrand. And then we managed that practice as well as five other practices. And those six practices in total, if you like, are in they're in tourist hotspots, they're in quite isolated areas. Some with levels of deprivation. So we're so we've again used that social value mantra and strategy and goal and value to then just ensure that those communities have that they've got care closer to home, to use the popular phrase.
Yeah. And what do you sort of understand by the phrase social value? Like, what does that mean to you guys?
Yeah, I mean, in terms of us, it's basically around providing value back into the communities socially. So whether that's by ensuring that care is available, whether we're there able to target areas where, um, particularly in terms of isolation, it's about ensuring that we're doing our bit for net zero. We're not making people unnecessarily travel. We're making sure that services that they need are available to them. Certainly, that's
Mm.
it more in the concept of a care provider.
So is it more, it's around, as you understand it, sort of ensuring that care is delivered in a sustainable way that delivers some element of sort of positivity within the community?
Yeah, yeah, and I guess in terms of some of the advantages, so whether that's, obviously healthcare's, free for all, of course it is, and that's the way it should be. Um, but in terms of just ensuring the social values going back into that community, so whether that could even be helping out charities, for example, whether that could be allowing, we've got a social enterprise committee that if like a staff member or somebody in the communities want to raise some money so we can contribute into that, and we've done that, about upwards of 30,000 over the past couple of years that has been reinvested back in, and that's come from within the organisation. We've backed and worked with charities to provide, asylum seeker clinics, health matters clinics. There's a whole range of services that we've provided as part of, delivering that social value back into the community.
Mm. And how did you kind of get involved in in Cumbria Health? I called it Cumbria Health on Call before. I apologize. Cumbria
Oh
Health.
no, no, it's all right. Yeah, yeah. It's honestly, I still call Starburst local fruits, so I'm totally with you. And yeah, the amount of times I have to, correct myself when I say chalk, because of course chalk is quite a catchy kind of phrase, anyways, isn't
Yeah.
it? So it rolls off your tongue a bit better than ch. So yeah, no,
Mm.
totally agree. But obviously the organisation needed to rebrand. So in terms of for myself, so
Yeah, yeah,
yeah,
you're
so
good.
I've been working in NHS for 17 years. Or although technically I'm not in an NHS organisation at the moment, but I feel part of it,
Mm.
because obviously that's where everything is in terms of what our business does is to NHS and social care. So prior to coming into Cumbria Health, which was about 9.5 years ago, the NHS organisation I worked for, I started off, well, yeah, prior to that, I was working, sales. I was working, telesales, door knocking.
Okay.
I was doing all that. I was working in factories and abattoirs, and I happened to stumble upon an advert for a 6-week position, which happened to be the head of IT
Okay.
as his personal assistant. So bit more like more of a secretarial role. I wasn't a great secretary, I must admit.
Come
So,
on.
and yeah, if he's watching now, he will agree with you. But what it did do was it gave us an insight, and IT was always a passion of mine. So it was something that I did in my spare time. Really, I didn't do it at school,
Right.
but it was always a passion, more of a hobby. So that kind of started my career, if you like. So, and from going from that 6 weeks to be, talking about it now is yeah, it's quite the journey that I've been on to do that. But working at the NHS Trust, I worked in business intelligence, I worked in performance management, worked in the information team, data production, data analysis, data development, a whole range of roles. I worked in projects for data quality, data improvement,
Mm.
and obviously being a working in a performance management role, quite a lot of what you did was very much projects. So when the chalk job, as it was called then, come up, it was an opportunity for me to delve into my first managerial role.
Right.
Um, and at the time, the organisation was, I mean, it was less than 200 people. Obviously,
Okay.
now it has grown significantly since then. And it's a fully 24/7 provided service. And
Wow,
what
you guys,
Cumbria
I
Health
didn't know you
does,
guys were 24/7. That's amazing.
yeah, 24/7, 365. Yeah, we're
Wow.
that's why my eyes are like. Yeah. It's
Yeah.
not just because this is what a 39-year-old man from Scotland looks like. It's yeah, it's hard work doing 24/7. No,
Yeah.
I joke, of course. But yeah, so and I guess what Cumbria Health does is, and certainly why I love working for the organisation. Obviously, we spoke a lot about the social value aspect, but it's an innovative organisation. So it's
Mm.
something that if you're a kind of, I'm a tech geek. I'm very keen and very enthusiastic, always looking to innovate and create. And yeah, it gives me the platform to be able to do that. And yeah, every day is different, which I think
I bet.
is
Well,
key
yeah,
to anybody's.
especially yeah,
Yeah.
that makes sense. And so I mean, you must have seen some incredible changes in your 17, 16, 17 years. I mean, what are some of
Yeah.
the big things that you would pull out from that period?
Oh, right. Okay.
The biggest
So,
changes?
I think the biggest change, when I think around, I think digital maturity is a big thing. Obviously, so I can remember, coming into the role, and everybody always talked about, oh, the signal strength in Cumbria,
Right.
and that was very true, of course. But I come from Scotland, so we were kind of like, all right, okay, well,
Yeah.
we've also got similar challenges. So I think the digital maturity and the opportunity that brings, I think people's appetite to change, and I think probably as we've seen this week, digital's always been talked about. It wasn't just a thing that came in and during the COVID pandemic. We've been on this journey of trying to transform services, but I guess it'll be interesting to see in the yeah where it goes next. But thinking about in terms of within Cumbria Health, yeah, there's lots of whether we talk about remote consultations, remote monitoring, remote diagnostics. IT when I first started in it was something that basically kept the computers connected, and now it's
Yeah.
keeping the patients connected. So that's
Right.
probably the biggest change.
Well, and I think in an area like Cumbria with that rurality, you guys have been pretty amazing at getting on the front foot around the sort of remote aspect of
Hmm.
it. Um, I mean, I know you mentioned at the beginning of the show, so you've got some places that are an hour away, or easily an hour's drive away from a hospital.
Yeah.
Is there any other? Is it one of the most remote, or is it the most remote sort of county or region in the UK?
So it's the second most sparsely populated region in the county, in the
What's the
country.
first?
Sorry,
What's the first? Do you know?
Northumbria.
Ah, okay. Well, which is pretty
Yeah,
close.
just across. Yeah, the closest one to us.
It's
Yeah,
pretty.
yeah,
It's
yeah.
pretty close by.
Yeah. Down south, sort of, yeah. I mean, down south there are some regions that are, that are in the similar ballpark, but
Okay.
yeah, those are the two.
And what are the specific challenges that throws up? That rurality.
Yeah, I mentioned an hour to drive. We've got communities that don't have access to a vehicle, whether that's their own or to others. So,
Right.
you can multiply that by three if you're taking public
Right.
transport.
Right.
Makes massive changes. Whether that's DNA rates, cancellations for appointments, being able to get to people. One of the big things that the Darzi report talked about was around delivering more productivity. You know, in some areas, absolutely, and we've got some great examples of services where we've really driven the productivity, but through the means of utilising digital
Yeah.
to help enable that. But from some of the other areas I talked about, if it's 2 o'clock in the morning and someone needs a home visit and it happens to be
Right.
in one of those areas, you have to go. But
Yeah.
again, because it's overnight, there are less clinicians to go around as well. So those
Right.
are the type of challenges. We've done benchmarking. We've got organisations similar to us. We've got a fleet of 12 vehicles.
Right.
Some organisations bigger than us have two.
Right.
So that just kind of gives
Yeah.
you an idea in terms of the logistics to deliver care in this way. But what it does do from a digital point of view is it allows us to use technology better. So our remote monitoring uptake is very high. Remote consultations is like video consultations is 12% of our total activity within the out of hours
Yeah.
service.
Okay.
Um, and I always use the argument in terms of that. I mean, that's delivering it unscheduled as well. So it's,
Right.
we're taking an
12%.
unscheduled
Wow.
service and turning it scheduled. So, so it presents challenges but opportunities.
Yeah, like mother is the necessity is the mother of invention.
Yeah. Yeah, exactly. I like
Yeah.
that one. I'll maybe write that one down.
Yeah, 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 yeah. So that's been a really interesting first part of the show, Richie. So we're going to break now, just do a quick commercial break, and then we'll be back with my guest Richard Mcgregor, who is head of digital and performance at Cumbria Health, which is one of the leading providers of NHS care in the north of England. CQC outstanding registered as well. So we will be right back after this short break. Hello and welcome to this week's Health Tech Hour with me, Steve Roest, and my guest today, Richard Mcgregor, who is the head of digital and performance from Cumbria Health, which is one of the leading providers of NHS services, obviously in Cumbria. And it's great to have him on the show. So, Richie, before the break, we were kind of talking about your journey and some of the things that you've seen change most dramatically over the last sort of 16 or 17 years in the NHS. Let's look forward a little bit. So, obviously, the Darzi report got a huge amount of coverage. What
Mhm,
I felt, I don't know about you, but there was a lot. I wasn't hugely shocked by a lot of it, but I was
mhm.
encouraged by quite a lot of it that felt like confirmation, certainly of what you and I have been discussing separately, just as we've got to know each other. But a lot in there confirms, I think, what you guys have been doing at Cumbria Health. I think the general larger picture, doesn't it? Sort of move more towards digital services, delivering value in communities, taking burden off of GP services by delivering services in the community, being flexible, nimble, etc.
Yeah, absolutely. I mean, we've been kind of, from some, external bodies that I've used as, probably describe us as a fleet of foot organization. We're willing to take on whatever challenges are there, and we're always, available to assist. In terms of from the technology front, so a lot of the services that we're providing, that's there for all the Cumbrian population. So they range from remote monitoring, some remote diagnostic, and obviously the remote consultations. At one point, we were providing for 8 charities in the region, and also the NHS Foundation Trust, and that was during the time of the pandemic. In terms of some of the other sort of non-digital, although digital does enable it, a lot of what we've been doing around the um, a lot of what we've been doing in terms of uh, hospital avoidance, if you like, because that obviously got picked
Yeah.
up quite a bit in the Darzi report.
Yeah.
So we've had schemes that have been running since 2017. Whether that's paramedics being able to hand over cases from a 999 call through to us as an additional triage, whether
Mm.
that's what they term as clinical assessment services, and that's all just handling and trying to stop. More patients coming into that front door. So a lot of what we've been doing, does meet some of the Darzi recommendations. However, that being said, you do feel as well that there is opportunity for us to flex even more.
Yeah.
It was great to read, have to invest in digital, because that's obviously been, something that a lot of us have been frustrated about over the years. There was a lot of, investment that came in during the pandemic, and rightly so.
Yeah.
It would have been great to capitalize on that even further, I feel.
Yeah.
In terms of, we're only scratching the surface in terms of some of the challenges that we've got. If I think so regionally, I saw this, start for one of the ICBs that we provide a number of services to, and that if we don't change in the way that we deliver services, then actually what will happen is that everybody in the next 10 years of working age will have to work in either health or social care to meet the demand. And that fits in with some of the, some of the national statistics, just
Wait,
around
sorry. So
the
hold on.
aging demographic.
Hold on. Roll that back a second. That because
Mhm,
of the demographic aging, every
mhm.
person and the increased pressure on the healthcare system, every person of young of every in theory to fill the demand or service the demand, everyone would have to work in the healthcare system that enters the working population. Is that what you mean?
Yeah, yeah. So that was a
Wow.
local stat. If health and social care delivery was to stay the same as it is now, with the anticipated demand, just as those aging demographics change. So, I mean, I read in terms of some of the national stats would back some of that up. Obviously, within our area,
Yeah.
it is a fast and aging demographic, anyways. It is a
Okay.
popular place for people to come and retire. We've got a large care home population, for example. So we'll probably get there quicker than others. But yeah, so that was within a decade. That was what the ICB had
Whoa.
had forecast.
Within a decade.
With,
And
within
what are
10.
the kind of
Yeah.
what are the plans? I mean, wow. I had not heard that actually. That's still trying to process that. So what are the kind of plans to mitigate against that? Because that's pretty terrifying.
Mhm. Yeah, I mean, well, I mean, in terms of, so I mean, some of like the national stats talk about that, the population's going to grow by 3 million more. This is only, in UK in
Yeah.
18 months' time than what we had 2 years ago. And because of that, we've now got 5 million more people age 65 or over than there was in the early 70s. That's quite a seismic shift.
That's
Um,
massive.
and some, yeah, yeah, and there was an independent report done by Deloitte, and it had estimated by 2030, so even less than the decade that I'm talking about.
Mhm.
But we'd have a shortfall of about 10 million workers. And that's based on a 30% increase in demand that's
Just
forecast by 2030, and
yeah. So
that's a national report. So,
there's a guy, he causes a lot of kerfuffle. Like, people don't really like him depending on your kind of worldview. But there's a guy called Douglas
mm,
Murray who writes for the
okay,
Spectator, and he ends up being on these GB News things, so he can be a bit controversial. But one of the things that he wrote about in a book which was called The Strange Death of Europe, which is it's a good,
mm,
interesting book. Not sure I agree with everything in it, but it's certainly very interestingly and well written.
mhm,
Um, was that there's going to ultimately have to be at some point a tipping point where European countries, including the UK, start to compete for migrants. So they need migrants to come in and fill jobs because
mm,
because of the demographics within those markets, particularly in the health and social care sector, right? And so
yeah,
there's going to be this weird inversion where suddenly at some point everyone's going to realize, oh my goodness, we actually can't solve these issues, and we're going to start to have to actually proactively seek out migrants.
mhm.
So I think it'd be interesting to see, because I mean, how does that even get solved within the using the current UK population? That kind of bleak maths is hard to square, isn't it?
Yeah, well, I mean, I mean, one of the key, the key aspects in the statement over if we don't do anything. So there really needs to be that seismic change in the way that services are delivered. So whether that is an AI keeps getting mentioned, which has got a massive part to play, of course, but whether that's in the front end patient services, there's probably quite a lot that we could do with that type of technology at the back end. And then
Oh my
what
god,
that would
yeah.
allow to do is move that workforce around. Certainly at the moment, there was one that I really quite liked. I do like quite a good little saying that I can call back. But in the Darzi report talked about in terms of move away from diagnose and treat and move more towards predict and prevent.
Right.
And in a lot of ways, that is, there's a lot of evidence in other countries to suggest that, they did like a channel shift between sort of a digital services, sort of traditional services into more digital, and there was none more
Mm.
so than Australia, for example. I
Right.
can remember
Okay.
when we first started to engage with Australia, and they'd obviously spent an awful lot of time in perfecting, I would say, because I do still think they will do it a far greater level than what any of us would, maybe outside the US, in terms of remote consultations. Conducting consultations over video, all the benefits that gives. It gives productivity benefits.
But
Patients
were
come
they
in,
were
come
they
back less compared to telephone.
they were in that early, were they? They went in on that quite early in Australia.
The, yeah, yeah, they did. Yeah, and I was just recent. So they've not long released their sort of 10-year roadmap. Um, so it came out 2023, and within the roadmap they talk about that sort of next level of their evolution. But to
Mhm.
give you a stat, so the surveyed Australian population, 85% of them had used online access. Um,
Okay.
so
Wow.
now which is a fantastic number.
Yeah.
Our numbers sitting at the moment, so the most recent numbers I saw at least,
Mm.
was it was just under 75% had
Okay.
used online access, so the 10% above. However, when you then take into account the number, so if you think the population of Australia is like 23, 24 million,
Yeah.
and of course we're like hitting 67, forecast to be
70
closer to
something,
70
whatever.
million by,
Yeah.
in the next 3 years. So that's a big number of patients that we've got to catch up on. So of course they're
Right.
now moving into their next level of their kind of digital journey, as it were,
Right.
in being able to, work with their citizens in a more digital manner.
So
So
do you think that like this the remote consultation piece is like the bedrock of remote services and training people, training patients, if you like, to embrace digital services? So is that like that's the beachhead? So if you can land
yeah,
remote consultation at scale, that allows you this go forward to start to interact with patients through a digital environment in other ways.
I think that's probably the entry point. Yeah, definitely. Because a bit like we're doing today, we're using Zoom to communicate.
Yeah.
You're in one place, I'm in the next place. Neither of us have had to travel. So instantly, my experience for this, I'm not going to have to get on a train or a plane or and then jump in a taxi.
Hmm.
I'm just going to be able to come to your cell. But once you start doing the remote consultation, although some would argue you could do remote monitoring first, I'm just using our example. We did the remote consultation in 2016. Then we moved into remote monitoring about 2018, 2019. Obviously, the
Hmm.
technology's changed massively now.
Yeah.
It's far more advanced. Um, some would argue remote monitoring came in 2012. I remember seeing a product for that used the text-based service. Some
Yeah.
would argue that was the start of the journey. Um, but in terms of you could do one or the other. But I do think delivering a lot of those technologies closer to home would benefit that. Access to care records is obviously the other one. The NHS App, is such a big thing now. That came up in the Darzi report.
Yeah.
Because that does give the patient, some of the tools that they need themselves. The registration for that is really high, but actually the daily basis or the weekly basis stats are quite low still.
Yeah,
I
they
think I
are.
read.
And also I've heard that some surgeries have like been switching off functionality as well. Like they have the ability on a practice level to switch functionality off. I don't know if you know anything about that.
Yeah, I mean, I was aware that at one point there was obviously because we've got practices, that there was
Yeah.
certain mandates that did come in. I can only really speak for our organisation in saying that we're compliant. I'm not aware of anybody in our local area that aren't, but I'm sure there will be some. There's so many, general
Yeah.
practice right across. But certainly as part of the national contract, they're mandated to do it. So, and
So
have done for some
sorry.
time.
So as part of the national contract, they're mandated to turn the NHS app on or integrate with the NHS app, are they?
Yeah,
Oh,
yeah,
cool.
through
Okay.
the yeah. So there is there's certain mandates that come down in the contract and that goes for even like digital telephony now is
Okay.
mandated. So
Okay.
yeah, so there's been a lot of progress in those areas in terms of contracting and regulation to ensure.
Okay. And was Lord Darzi, he was very positive about the NHS app, was he? I didn't read that bit.
So I think in terms of in his report, obviously, I think I'm obviously paraphrasing here, but it was certainly that we could go further with it.
You
Is
definitely
essentially
could.
yeah,
You
yeah. I
definitely
mean,
could.
you even think in terms of its utilization, promotion of the symptom checker is really good. The link into 111 online. We've developed. I say we've developed. We never developed it. We've designed, if you like, a pathway
Hmm.
whereby so if a and this has been an operation for since before the pandemic.
Yeah.
So what you could do is I think 111 online went live in 2018. So
Yeah.
you could, on your phone at the moment, go on 111 online, fill in the symptom checker, and let's say, for example, it was a rash, and it was deemed as a rash that didn't require you to go to the emergency department. The
Mhm.
case would drop into our system electronically. You would be given a video appointment, and sometimes that's done directly booked. Sometimes it requires us to call you to
Yeah.
book you in an appropriate slot because of course, as well as knowing that you've got a rash and it's non-urgent, it gives us a time frame as well. So it'll say, 1
Yeah.
hour, 2 hour, 6 hour. So we need to find you an appointment within that available slot. You get the video appointment, which is delivered to you via SMS. We've got alternatives for digital inclusion, of course. You click that link at your appointment time, you're connected straight to a clinician who would diagnose you. And if they
Mhm.
wanted to send you a, if you needed a prescription, which 1 in 2 people that present in our services do, then we would just electronically send that to your pharmacy. So
Right.
if you're one of those residents in some of the areas I talked about, like some Millom or Alston, that you're
Mm.
maybe, an hour away from local health services, there's no public transport, you can't get anybody up out of bed to take you in.
Yeah.
You're going 10 minutes down the road for a prescription instead of traveling all the way to the hospital for a 10-minute
Yeah.
appointment to then go all the way back.
Well, mate, I mean, it
As
just,
as well as all the infection and everything else that we know in
yeah.
terms of hospital waiting rooms. So,
What,
so yeah, so
but is there anyone realistically, and we can maybe get into this because we're about to stop for our second break, but like, is there realistically a counter argument to any of this? Like, or is it just a question of how it's implemented and when different bits get implemented? Is there really like a valid, logical counter narrative to this stuff?
I mean, the common one that I've experienced over the years is that people don't have the technology, or they
Which is,
don't
I
have the
think that,
connectivity.
so I think those two are valid. Those are two
Yeah,
valid
yeah.
ways.
However, I mean, there are stats that would suggest, when you're delivering these services, 98% of the population between, I think it's like, 16 and 75 would have them. But then the number during the pandemic that grown in the over 75 age group, I don't have the stats to hand, but we do have now things like the National Device Bank, we've got National Data Bank, and
Mhm.
National Digital Inclusion Networks. So there are means to be able to get devices and also to have data sims. We're looking at, I think 5G coverage is 93% by land at the moment. Obviously
Yeah.
4G is much higher. So there are ways and means to combat that, which maybe when we first started on our journey, that wasn't quite there. The other thing was around use of technology. Was so I've got my phone, and I've got family members like this. Um, hope they're not watching. Well, if they are, I don't know who they are. Um, but yeah, I don't know how to use the technology. And interestingly, so with that video receptionist service I mentioned that we do, or the video treatment center, we used to call it a virtual receptionist service. The receptionist was physical, just a receptionist behind a screen. But
So,
we put that role in particular in place for the reasons of use of technology. So you had that person that could handhold, that essentially if
right.
you didn't turn up for your appointment, they would contact you, they would talk you through it. The system was
Yeah.
was pretty good anyways, but they were also there to calm you down if it didn't work, and then give you the
Yeah.
it's okay, this hasn't worked, you'll go over here
Yeah.
instead. So we don't have that
Yeah.
person in that role anymore, but the people that did it are still around, and it's not very often that they have to get involved with any of that now. It did when we set it up, but certainly as I think the populations become more digitally mature, and that will
Yeah.
continue as well. Some of the stats I'm talking about that are common in terms of like in 10 years' time, and people will be using technology more and more. The banking industry always gets mentioned, doesn't it? As
Yeah.
a good or online shopping. So they're always
Yeah.
the takeaways from this that people will always bring to you, and
Yeah.
say, oh well, it works there.
Yeah. No, I agree. I think the direction of travel is set. I think it will depend on the speed and what gets implemented, where it gets implemented, how cost efficiently it gets implemented, and sort of managing that change about what we're not going to do anymore, and sort of that transition. But we can jump into this a little bit more because our experience at PocDoc has been uniformly
Mhm.
positive, where we've been delivering a
Yeah.
complete new model of care of digital diagnostics, people testing themselves at home, people being tested in communities, and we've been overwhelmingly surprised with people's capability around the technology, particularly at home. Where I think sort of the perceived wisdom, quote unquote, if you like, is in certain
Mhm.
areas, in certain communities, it's very difficult for people to use technology. And actually, yes, that still exists, but I think it's better than the perceived wisdom says it is. I
Mhm.
think
Yeah,
people's
it's totally
capability.
agree.
And I think it's
Mhm.
an element of like there's sort of somehow this unwillingness to try it just in case someone might not be
Mhm.
able to do it. But it might work for 9 out of 10 people. But if one person can't, then I think we have to get ourselves in a situation where we say 9 out of 10 is still better than 0 out of 10. And we try and
Yeah.
help, like you said, you help that one person negotiate this, navigate this as best as possible with support, with companions, with however, with however it comes together. Because for the 9 out of 10 people, it's just fundamentally a more convenient, better, more positive experience.
Yeah, and to be fair, when I think of the way, in terms of services, right, the way I've worked in, various, yeah, with various different clinical specialties, and sometimes the normal, service delivery, if you like, doesn't
Hmm.
meet it for everybody, and then what you then have is you have other services that are set up to specifically work with that group of individuals, and there's lots of examples, around that, and I'm not proposing that we would ever get in a stage where you would almost have like a digital offer and a non-digital offer. That's not what I'm
Hmm.
saying. It's more, the people that can use a lot of technology from day zero, because they're going to get things quicker. Is going to be
Yeah,
a bit more effective. It's not going to be for everything, because you're still going to need to go. We always say, don't we? The gold standard is face-to-face care. However,
yeah,
because of some of the stats we've talked about today, that is not always going to be possible. And other countries are probably
no,
further on ahead of us
yeah,
along that journey
well,
now.
yeah,
What we're kind of
and
saying
also
is,
like
let's put the extra work in with those.
yeah, I also think that for some people, they don't want to drive an hour to have a GP appointment in the middle of the day. Or 2 hours. They might their definition of gold standard of care may not be that, and
Hmm.
also everyone's definition of face to face has shifted. I think
Oh,
dramatically. Like I
totally.
would consider this interaction face to face. I can see you, you can see
Hmm.
me. So I think that there's all kind of macro dynamics here that is shifting.
Yeah.
But we can come back to this in the last part of the show because my producer is waving frantically at me that we go for our final commercial break. So we will be back in 2 minutes for the last part of this week's Health Tech Hour with me, Steve Roest, and my guest, Richard Mcgregor from Cumbria Health. Hello and welcome back with me, Steve Roest, to this week's Health Tech Hour with my guest, Richard Mcgregor, who is the head of digital and performance at Cumbria Health. Cumbria Health are one of the largest providers, they're a social enterprise, one of the largest providers of care in the north of England. So, Richie, just before the break, we were kind of digging into these changes that are happening in people's definition of things like the gold standard of care and these sort of trends that are making it harder to say, well, everyone should have a face to face, which was something that I don't know. I think was a policy that the Conservatives threw out in the last days of the last dying days, where they said, "Oh no, everyone should be able to have a GP appointment by law within a week, in person, without having spoken to anyone in the GP profession." But it's all kind of shifting now, isn't it?
Yeah, absolutely. I mean, in terms of I think, and probably what we mentioned about the Darzi report, but there's probably lots of other examples from other reports that have come out, not just UK but globally, around you know how we deliver care, essentially, and yeah, I mean, I think what we'll probably see is a shift. I think it should absolutely be person centered. It should be, with practices of patient participation groups, for example. So that's the voice, if you of the practice from the public. Um, and you know, I think people just want care. It doesn't matter in what sense they
No, I
get it.
agree.
Um,
Yeah.
and a lot of it does talk about, we do live in an age where everybody wants things quicker. We was talking
Yeah.
about the way the Amazon deal.
Yeah.
I can go on, I can pick something, and I'm not comparing health to Amazon, but certainly the idea of that kind of delivery, certainly as we come up in those aging groups. I mean, I'm getting there a bit quicker now, but yeah, that's the type of stuff I'm going to want when I always say I'm trying to perfect it for when
Yeah.
we get there, and the people in the hospitals are the people that need to be in the hospitals. The people in the
Hmm.
general practice are the ones that need to be in the GP practice.
Hmm.
Um, and in terms of the cohorts, it's changing all the time. When you look at a lot of the patient experience questionnaires, I can remember we had to do a digital roadmap, and it must have been in, I want to say it was like 2015, and we surveyed the patients, and we asked them about receiving their care online,
Mm.
and like it was upwards of 80% said that they would, and that was
Yeah.
in 2015, maybe 2016. So and a lot of the national stats say the same.
Yeah, no, exactly. It's completely switched. So let's touch on something that we talked about earlier, which is this remote diagnostics piece. So if we
Hmm.
talked about, you remember you laid it out really brilliantly, where it's like a phased approach, which is like phase one, you have remote consultations or telehealth or video, whatever you want to call it, and then you have remote monitoring, and then on top of that, you have remote diagnostics. So, like, let's talk about remote diagnostics because I know that we've worked with you on the PocDoc side of
Yeah.
things with Cumbria Health, and we're really excited about that. Mostly in the area of cardio, metabolic, and renal disease prevention, and really kind of trying to take this new model of care out into the community. But why don't you sort of explain that vision of this diagnostic step being the next phase for you guys?
Yeah, so I mean, so our kind of second step, if you like, was remote monitoring. So we were very focused on, let's wait till someone refers to us, somebody that might have hypertension, for example, which of course, it's known as the silent killer. Cardiovascular disease is the single most preventable, deaths that we have. 80%, I believe
Yeah,
the stat is that it's preventable. So
yeah,
actually, the next phase of ours, and it's when we've obviously got to know each other, is around how do we do this en masse? Because there are so many people out there. So if we take NHS health checks, they're there for everybody between 40 and 74, and I'm pretty sure like the last time I looked, the national percentage was it was under 20%.
yeah. It's
So
very
that's
low.
almost saying it's very low, yeah. So it's less than, and we know the reasons for that. Practices are. It's probably all what we're talking around and what Darzi's put in his report. The fact that you have this gold standard that everybody should get it between 40 and 74, repeat every 5 years, and if you have it, then and you have it, and then you find out what your risk factors are. Either you can do something about it, or your general practitioner can put you on a pathway, or certainly onto a register to ensure that you get the gold standard of care for that condition, whether that's hypertension, chronic kidney disease, whichever.
Mhm.
So, what our kind of vision in that was, how do we do this en masse? Because at the moment, we're only getting the referrals for a lot of these services when we find out about them. So, we even took out buses around North Cumbria and in South Cumbria in some areas, and we were trying to pick up people in terms of their health checks. We were inviting them on board. Like I was literally in a Tesco car park one day at the front
Yeah,
door with a lady
yes,
from the ICC.
yeah,
You guys were
yeah.
there as well, and
We
we
were
were bringing
there.
them
We were
across.
there.
Yeah, yeah,
Shout out to Luke Dawson from our
yeah.
place. He was
Thanks,
there
Luke.
in the car
It's yeah.
park.
It was quite it was quite an experience for him,
Yeah,
in terms of that. Plus positive, of course,
yeah.
but
It was.
so we're bringing people over. So I think what the product does is it gives us that ability where we can do a digital check, which would give us the same amount of information. It's probably easier to use than potentially the NHS app. It's easier to use than probably a lateral flow test. You'd
Mm,
certainly gag less than what you would do in terms of taking a
yeah,
sample of your own blood to put in, and then getting the results in a very quick period of time delivered to the care professionals that need it, that can then go on. So when I
yeah,
talked about our model, if you like, with let's take the traditional patient workflow for how they consult with a GP, and let's
mhm,
digitize it, which is what we did with the 111 online service, which resulted in the video consultation. What we'd like to do, obviously, or what we are doing, not like to do, is taking the health check process and let's digitize it. Because what we do know, the same reason why someone doesn't want to drive all the way from Millom to Barrow to have their appointment when they're only going to be in there 10 minutes and
yeah,
their entire elapsed time is probably about 4 hours.
yeah,
There's the same way people aren't, taking the time off work to go
yeah,
for their health MOT. They're
yeah,
not for their health MOTs, if you like. So instead, actually, can we do this digitally?
yeah,
And that's something that we'll be embarking on. We've got quite an ambitious target to hit over the next 6 months, but
well,
it's something that we're quietly confident around. But
yeah,
if we
it's
were doing it face
exciting.
to face, it wouldn't be possible.
No, and I think that I think we're really excited to work with you at PocDoc, and I think it fits with our vision of this idea of going where the people are, trying to deliver this really, really rich diagnostic screening. So not just the test result, but the risk assessment, the follow-on care, connecting into that wider digital ecosystem, so the GP can see the results and some clinicians can decide what to do, and delivering that whole pathway for the prevention of these diseases at scale. So the only
Hmm.
way to deliver at scale is if you can create something really usable, really fast, really accessible, um, that can not just deliver this test result, but that can do the whole thing, digitally driven, but interacting with the patient and putting in place those care pathways and those clinical steps to make sure it's the best of both worlds. And we're obviously really proud that we're working with you guys on that, and in other places across the country. And I think credit to the Department of Health who put a lot of this funding in place,
Yeah.
around this prevention piece. There's some great people working at the Department of Health and a unit called OHID as well, who are completely behind this vision, even before the Darzi report came out,
Hmm.
of really trying to figure out how can you scale this health MOT, this health check, because in some instances, in some places, it's actually under 10%. And actually, what we found, you might have found the same, is that it's for the most part, it's 2 appointments, sometimes 2.5 appointments for the actual health
Hmm.
check, because you have to go in and have the blood taken, then you have to come back and get the results and be spoken to, because they don't know what's wrong with you, or they don't know what your risk is until they get the blood test results back. And so it's
Plus
not
the
just a
system
simple.
cost as well.
Yeah,
Blood
exactly.
results, you have to drive them there.
Yeah, there's all kinds of things, and the thing that we found most recently, which is really exciting for us, and an area that we're looking into now very rapidly, is that GP surgeries, generally speaking, aren't able to offer health checks in 9 to 5 hours. Like,
Yeah.
that's not something that they're really able to do, and the reason is that they have a huge number of other cases to see in 9 to 5 hours. And so, how can
Hmm.
this new model of care enable health checks to still be done, at-risk people to still be found, but not burden GPs? Um,
Well,
so,
it fits in quite nicely with the what Darzi said in his report as well, doesn't it? It's that predict, prevent. Um,
predict event,
because and we're
absolutely,
probably going to find stuff out that would maybe be assumptions with some of the areas that we use it for, but then
yeah,
again we might not. But at least we'll know. Um, and
absolutely,
as you say, people end up on the correct register. It'd be
exactly,
interesting to see in that space where it how further it can go. There's
yeah,
other conditions that can be diagnosed that we're aware of. We've got lengthy waits. So yeah, we're hoping to do quite a few exciting things in that space to just increase that kind of value that we're providing across
good.
the health service and social care.
So, Richie, that's great. Richie, thank you so much for coming on. That was a wonderful show. Um, I
Thank
just
you.
want to say thank you to everyone for listening. We'll be back again next week. And Richie, thank you for coming on the show. If people want to find out more about Cumbria Health, where do they go? Your
Yeah,
website?
so you can go on our website, so www.cumbriahealth.co.uk. You can find it in a Google search, of course, and we're on all the social media channels as well.
Great. Perfect. Well, look, thank you very much for coming on the show. And thank you very much to everyone for listening.
Thank you.